The death toll due to coronavirus has crossed 7,100 and more than 182,000 people have been tested positive for the virus. It is being reported that 14.8% of the dead among the infected people are aged more than 80, making the subject group to be the most affected. Now, here are some of those methods to adopt in order to contain the spread of the deadly virus among the elderly. People can visit their elderly relatives or friends only if they find it absolutely necessary. It is essential that one maintains a distance of at least 3 feet between individuals and not have any physical contact. It is also advised to completely avoid visiting people over 60 if a person is suffering from any kind of illness. Geriatricians who specialize in the healthcare of the elderly have advised people above 60 to be very careful. Doctors have recommended them to be adherent to the following: all the guidelines given out by the World Health Organization and health departments of each country. It is also very important for elders to wash their hands frequently with soap and lukewarm water, avoid handshakes, and make sure they're never part of a large gathering. Experts believe that older adults are at higher risk of cancelling doctor's appointments, but the virus spread depends on persons' location and community, and if required, elders can keep in touch with doctors through phone and stockpile 2 months of any critical medical prescriptions. Like in Australia, stores open an hour early exclusively for elderly and disabled customers. Now, it is also mandatory for elders to get tested for the virus only if they've come into contact with an infected person or start to develop symptoms of the lethal virus. Now, millions of people above 60 live in nursing or old age homes. Amidst this global outbreak, most centres have started to adopt strict measures to contain the spread. However, people must also ensure that the nursing homes have enough comfort for the elderly as they have at home. And finally, family and friends must limit their visits to only emergencies until the virus has reduced. Doctors fear that social isolation may further worsen elder people's health. The stress on maintaining good social interaction, sufficient sleep and healthy eating. Now, it is also advised for elders to keep in touch with their family through phones and video calls. And they have called for greater usage of technology and have highlighted the need for some activity when in isolation. Older people are more likely to become a victim of this novel virus. So far, more older people have died due to the deadly virus than anybody else. Existing health conditions of older populations have also worsened the recovery process from COVID-19. Governments across the world have continued to advise everyone, especially senior citizens, to suspend all non-essential contact with others and practice social distancing actively.